the physical assessment. We are going to continue with assessment of the breast and abdomen, and then health promotion. Initially we thought we would have 3 videos, but it looks like we're going to have 4. So in this video we're going to focus on the breast, on abdomen, and the health promotion. First, let's begin with inspection of the breast. The patient is sitting with the arms. Keep your arms at the side, relax them at the side, and I'm inspecting the appearance of the breast. We're pretending the patient is undressed due to privacy and due to the age of the person. We cannot do that. We're inspecting the skin for color, for size and symmetry, and as well as the characteristic of the areolas and the nipples. Areolas and the nipples, they look normal. There's no lesions, there's no bumps. The next thing I'm going to have to do the patient is to raise your arms up over your head, just one of the arms. We're going to inspect each breast, and then you're going to have to press your hands against the hips like this. And then you can lean forward and dangle your arms. Well, I cannot see the breast like that, but that's how the technique is being done. And I'm checking the breast for contour in each position. The next thing is I'm going to have the patient, so this is just the inspection portion. Let's have the patient supine, meaning please lay down. Yes, get comfortable. And now we're inspecting the breast in the supine positions. The lateral portion of the breast and the arm over the head. So your arm goes over the head, and I'm inspecting the lateral portion of the breast in this fashion, and then you should be lifting the other arm, and the same, we're going in this fashion, checking for any bumps, depressions, anomalies, and different feelings, and vertical overlapping fashion as well, just up and down, and then we want to breathe in a star shape away. And we want to go around the breast. Very good. Also, when we're examining the breast, we would like to also assess the lymph nodes, the axillary lymph nodes, the supraclavicular lymph nodes, and the infraclavicular, which is like a little bit higher up. Okay, while the patient is still in a supine position, I'll be examining the abdomen, inspecting it so this is our abdomen. For privacy, we can expose it. I'm watching for symmetry of each side. I am using my stethoscope. I'm using my stethoscope to listen to the bowel sounds. Well, it's part of before I auscultate for the bowel sounds, the skin is also assessed for any scars, any stria or stretchy marks, any dilated veins, rash, and also I'd like to observe and palpate the umbilicals for any enlargement or any anomalies. When we auscultate the bowel sounds, we would like to auscultate for a full minute. We start in the following fashion. So this is the umbilicus, from ascending, transverse, and descending. We should hear some gurgle rhythm sounds. the broods. If we hear broods, that would indicate occlusion, and the broods are usually heard over the aorta, the renal arteries, and the iliac artery, which is at the level of the umbilicus, and the femoral arteries. Let's percuss the different quadrants of the abdomen. We have 4 quadrants: the right upper quadrant, and the left upper quadrant, the left lower quadrant, and the right lower quadrant. This is how our abdomen is separated. In the right, so let's examine the liver span, which measures the vertical span of the liver downest in the right mid-clavicular line. So mid-clavicular line is here. So here how we will percuss the liver, but actually we will have to use a light percussion to strike below the umbilicus in the right lower quadrant. And to palpate the liver, this is the fashion for palpating the liver. Next, we have to percuss the spleen, which is on the left side. The percussion is done to detect splenomegaly or enlargement of the spleen. So these assessment skills are very important. We percuss by percussing the left lower anterior chest wall at the 6th rib, down the costal space. Let's continue with the health promotional activity. I would like to add the health promotional activity here. It is an education on the importance of the influenza and pneumonia vaccines. The streptococcus pneumonia is a bacteria that causes pneumonia and meningitis, and it can potentially lead to sepsis and even death. That is why the pneumonia vaccine was created, and it has proven to reduce significantly the complications of the pneumonia bacteria. The pneumonia vaccine is recommended for patients who are 65 and older, smokers, anybody with cochlear implants. You can take me. Anybody with cochlear implants, and immunocompromised patients. The next vaccine I would like to talk about is the influenza vaccine, or so-called the flu shot. Every year, the flu shot vaccine gets updated based upon the virus, based upon influenza vaccine claims thousands of lives each year, and the flu shot is recommended to be tested annually. Well, the flu is tested annually, but the vaccine is updated yearly, again annually, and it is recommended for patients with chronic illnesses such as COPD, chronic conditions, pregnant women. Also, it's recommended for older adults who are in long-term living conditions in nursing homes. The influenza vaccine comes in 2 forms. In an injection form, it is due to a killed virus, and then it comes also in a nasal spray form, which is live
10 minutes.
attenuated or weakened virus. And the nasal spray is recommended for people from 5 to 49 years of age. This is very important that we're up to date with our immunizations and prevent illnesses, not only to ourselves but to our family members. Thank you for watching the video, and we'll have one more last fourth video. Thank you.